Hello guys, I am Angeline from Christian College of Physiotherapy. Today we are going to present a video about model anatomy Viva. So let's watch and make it useful guys.
Excuse me, ma'am.
Yes, come in and take your seat.
Thank you, ma'am.
What is your name?
Varun, ma'am.
Okay, Varun, tell me your roll number.
7919045.
We know there are 33 spinal bones. Can you tell me the structure of all vertebral bones?
Yes, ma'am.
Okay, then tell me about the cervical region.
Mom, the cervical spine is made up of 7 vertebrae. The first 2, that is C1 and C2, are atypical vertebrae and called by the unique name that is atlas and axis. And the remaining 5, that is C3 to C7, called typical vertebrae, has vertebral body, vertebral foramen which is large and triangular in shape, and the bony structure which consists of pedicle, lamina, spinous process, transverse process, articular process, and articular facet. The cervical region is more flexible than the thoracic and lumbar region.
Okay, good. Point out the structure of sacrum.
The sacrum is formed by the fusion of the 5 sacral vertebrae. It has an inverted triangular, concave shape. The bone consists of a base, apex and surfaces, anterior or pelvic surface which consists of transverse ridge and anterior sacral foramina, posterior or dorsal surface which consists of 3 crest, that is medial crest, intermediate crest, lateral crest and dorsal foramina.
Good. What about the lumbar region?
The lumbar spine consists of 5 movable vertebrae numbered L1 to L5. As with other vertebrae, each lumbar vertebra consists of a vertebral body and a vertebral arch. The vertebral arch, consisting of a pair of pedicles and a pair of laminae, encloses the vertebral foramen and supports spinous and transverse processes.
Okay, now tell me about thoracic vertebrae.
The thoracic spine consists of 12 vertebrae, that is T1 to T12. Along with the sternum and ribs, the thoracic spine forms part of the thoracic cage.
Okay, good. Can you structure the ribs?
Yes, ma'am. Rib consists of a head, neck and body. The head is wedge-shaped and has 2 articular facets separated by a wedge of bone. One facet articulates with the numerically corresponding thoracic vertebrae, and the other articulates with the vertebrae above. The body, or shaft of the rib, is flat and curved. With sternum it helps to form thoracic cage.
Name 2 organs located in thoracic cage.
Mom, heart and lungs.
Tell me the function of lungs and explain its functional process.
The main function of lungs are exchange of gases, that is carbon dioxide and oxygen, through respiration. The oxygen from air enters the nose during inhalation, the nasal cavity filters the dust particles in the air, then the air enters trachea or windpipe through pharynx or throat. Now air passes through the windpipe and 2 bronchi which forms very narrowed branches called bronchioles. Small air sac or alveoli receive this air and the oxygen from the air diffuse into the blood through capillaries during the diffusion process. While exhalation, diaphragm moves downward, creating space for the lungs to expand, decreasing air pressure in lungs. When diaphragm moves up, putting pressure on the lungs, then the air from them moves out of the body or get exhale, taking the reversed path, that is bronchioles, bronchi, windpipe, pharynx, then nose or mouth. In normal humans, respiration is done 12 to 20 times per minute.
Very good, Varun. You may go now.
Thank you, ma'am.